Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Kwasigroh, and we are here today at the Lift talking about cancer rehabilitation at Kirkland Cancer Center. Joining me today is Cathy Sudbury. She is the Sports Plus marketing manager, and we also have special guest Felicia Ingram. She has a bunch of letters after her last name, and I'll list them in the description below. Very well accomplished physical therapist and a program manager. How are you guys today?
We're doing great. Thank you for having us.
Absolutely. Glad you're here. So I mentioned we're going to be talking about cancer rehabilitation at Kirkland Cancer Center today. So what do you do exactly, and what does that mean, cancer rehabilitation?
Well, it's still physical therapy, no matter what the setting is. A lot of people, when they think about cancer rehabilitation, they're thinking in terms of treating people who have a diagnosis called lymphedema. But in actuality, as a physical therapist located within a cancer center, I still address some of the same things that you would receive in an outpatient center, such as weakness, balance problems, fatigue, joint stiffness, things of that nature.
So things that they might do at Sports Plus North or at Trenton or somewhere like that, you would still do at Kirkland Cancer Center. Gotcha.
And one of the things that the general public doesn't realize, once you've been diagnosed with cancer, you're so overwhelmed that you forget that you need to have physical therapy.
Right.
That is usually the lower thing on your mind to think about gaining the strength back. That is the reason we have Felicia over in the Kirkland Cancer Center to help these patients to get back on track. Felicia, how long have you been over there now?
I was sent over there to help out in 2017.
Felicia has the support of the physicians and the nurses over there in Kirkland Cancer Center, and the main goal is to get the patient better. So, Felicia, could you tell what you may experience, what type of therapy, cancer patients that come through?
Well, there's a variety of things that I see. When we look at the breast cancer population, some of the patients come in before they actually undergo radiation therapy, simply because when you go through radiation, there's a position that your arm has to be in for them to be able to reach the field that they need to reach in order to do the radiation. And sometimes because of limited range of motion, they have a lot of discomfort trying to not only get into that position, but to maintain that position. So I'll see them on the front end to try to restore that range of motion, to try to decrease the pain, get them where they can tolerate that part of the therapy, and then see them again afterwards, because sometimes after radiation therapy they start developing swelling that just will not go away after a period of time.
For that swelling, there's a special treatment. Could you elaborate on what that is exactly?
The treatment that we use, the swelling, that you have different types of swelling, post-op swelling that tends to handle itself over a period of time, but then there's a swelling called lymphedema. And lymphedema is a problem with the lymphatic system, which is the part of the body that helps maintain fluid balance. Whenever there's a problem with that system, then your body starts accumulating fluid and has a problem getting rid of the fluid. And so then you need to see a specialized lymphedema therapist. I know that in today's society, there's so much, if you Google it, there's so many different tricks that are out there that are being publicized. There's so many different people that are out there saying that, yes, we can treat this. But for your safety and for your best outcomes, what you really want to do is look for someone who's been certified in manual lymphatic drainage. And it's an all-encompassing type of treatment. It's not just a massage, but it's a specialized massage, knowing the lymphatic system, knowing how to redirect that fluid so that we can not be pushing the fluid into an area that can't handle the fluid, but we're redirecting it towards the part of the lymphatic system that's considered to be healthy. Not only with the massage, but we also do exercise, specialized exercises. We do compression therapy either through bandaging or through compression garments. Then we also do a whole lot of education. Education is key.
But not everybody develops the problem with the manual lymph drainage. So that is the reason we like to do physical therapy first, so we can teach them that doing exercises helps keep that from happening. Is that correct?
Yes, whenever you look at the statistics, there's two different types of approaches that's being used to treat the breast cancer. There's sentinel lymph node dissection, and then there's an axillary lymph node dissection. With those that are getting the sentinel lymph node dissection, those people, they really fall into more of the 5 to 17% ratio of people that tend to get lymphedema. When you get the axillary lymph node dissection, those people tend to fall into more of a 20 to 53% chance of developing the lymphedema. But whenever we look at the lymphatic system, sometimes because of scar tissue that's formed, that can cause an impairment in the lymphatic flow. And so doing exercises to help create a home balance within that system tends to help recreate the flow that needs to take place to get the fluids to flow in the way that they need to flow. So exercise could be the only thing that you need, or sometimes you have to go into a more aggressive type of therapy. And the only way to do that is to meet with a physical therapist and let us help you to determine if that's the course that you're needing to take.
So Felicia, a minute ago you said you guys can redirect the fluid in the lymph nodes. What exactly does that mean? I didn't know that was a thing.
Yes, when you look at the lymphatic system, it's a very intricate system. You have so many vessels running throughout the body, and those vessels are interconnected. There's different layers, that connection. We have the superficial layer, we have the deeper layers. Not to go too deep into the anatomical aspects of it, but there's a special way that we can assess to see exactly where the lymphatic system is functioning properly and where the lymphatic system is not functioning properly.
Okay.
And so we do a massage to help the fluid that's in the non-functioning area to move it towards an area that is functioning, and those healthy lymphatics can then absorb that fluid that's hanging out in the connective tissue.
Wow. Okay.
If someone has just been recently diagnosed with breast cancer, are you seeing them at the beginning? Or are you seeing them after? How are you part of the process over at the Kirkland Cancer Center?
It varies because there's some people, a lot of times people think, well, with physical therapy, especially cancer rehabilitation, they think the physical therapist is only going to be incremental as far as part of being a part of the team after the diagnosis, after the chemo, after the radiation. But you have to keep in mind that these people are coming, it's just like with us sitting at this table. I'm pretty sure that each one of us have some type of physical ailment, some type of issue, joint issues, or some underlying health issues that need to be addressed or can be addressed by a physical therapist. And so there's some people that come in before they even start undergoing the cancer treatment to get themselves in the most optimal state to be able to undergo the chemo and the radiation. Because, say for instance, if you're already battling with fatigue, you're already battling with some pain issues, you're already battling with some joint stiffness, it would really help to make everything more tolerable if you get all of those things under control on the front end, then undergo your chemo, undergo your radiation. And that way, once you've gone through those treatments, the effects of it is not as compounded. But then there's some people that get physical therapy in the midst of it. You know, they're going through the chemo because there's certain type of chemo drugs that cause proximal joint weakness. And what we talk about when we say proximal joint weakness, we're talking about weakness in the hips primarily. So some of our patients, they're going through the chemo treatments. They were doing fine, but after a certain number of treatments with the chemo drug, then all of a sudden they're having problems standing up from a chair, and they don't understand why. Some of the doctors will, because they know that it's because of the muscle weakness, they will refer them to me, and I will help give them some exercises to help restore some of that muscle strength as much as we can to counteract some of the side effects of that drug. And that way they can still remain functional throughout the chemo. And then after they finish with the chemo, after they finish with radiation, if they have to undergo the radiation therapy, then they come back to me and we're like, okay, now let's get a little bit more aggressive with this therapy.
Although we've been talking, Felicia, regarding just breast cancer, you have more options for anybody going through cancer, correct? It's not just the specific breast cancer diagnosis. So if they've been diagnosed, maybe say colon cancer, you're doing treatment as well for that, correct? Is there an example of what they may be facing, different exercises, or is it all the same type of physical therapy?
Well, it just really depends. It's still physical therapy. So basically what that means is the patient comes in, we do detailed assessment of what's going on with them. We don't just, if you come in and you tell me, oh, my shoulder hurts, I don't just look at your shoulder. I want to sit down, and that's the difference. That's the thing that people really love about physical therapy, because they go into other healthcare settings and the healthcare provider is rushed for time, and so it's a quick in and out. But in a physical therapy setting, typically you get 45 minutes of our time for that evaluation, which means I'm going to really pick your brain to find out exactly what's going on with you. What's your history? What's your medical history? What's your previous functional status? Okay, now how does that compare to your current functional status? Because that's going to tell me some things that are going on in terms of maybe your gait or your ability to walk has changed. Maybe your joints are not functioning the way that they need to function. It's an overall head to toe assessment that I do. Not that I'm trying to just find something in order to be able to bill your insurance, to be able to generate some money for our system. What I'm really wanting to do is to make sure that we're addressing every need that you have, so that whenever you leave the physical therapy setting, the episode of care, you're able to get back out and do everything that you've desired to do, even beyond the cancer.
So you're actually looking for that underlying exact problem, because shoulder may be coming from the neck. So you are taking the time to find out what is that underlying problem, not just the cancer, but what else has been going on in that body to help them function correctly.
Absolutely. And if I could give an example, one thing that's pretty common is patients who have undergone radiation therapy or chemotherapy, and especially chemo, and they'll say, well, one side effect of chemo is neuropathy. So I've got tingling in my hands, or I've got tingling in my feet. And so they dismiss it as it's just chemo-induced neuropathy. But they come in because one of the physicians said, we've tried the drugs, we've tried different things, you're still having issues, go see Felicia. Let's see if she has anything to offer. Well, whenever I'm doing my assessment and I'm listening to what you're telling me, and you tell me, because neuropathy tends to be pretty similar one side to the other. But if you're telling me, well, my right hand is tingling more than my left, then that raises a red flag to me. I'm saying, okay, that's not typical. So then I'm immediately wanting to assess the spine. I'm wanting to see, is it coming from the neck? So I will do, like you said, I will do a thorough assessment of the neck and your upper back, and just anywhere I think it may be stemming from. And some of my patients have been surprised by the fact that they're thinking they're going to have to live with this excruciating, just terrible tingling, numbness in the hand. I do some treatments to help with the neck, and then all of a sudden, this tingling that they thought they were going to have to live with for the rest of their lives has gone away. But it was because it was a neck problem. It wasn't a chemo problem. That's an example of one of the things that we do, and not only for the arms, but even for those patients who have gone through the colon cancer or whatever other cancers are out there where they had to receive the chemo and we're told that they have the neuropathy. I have some patients right now that I'm treating with our MDT approach, doing some back rehab and getting great results.
So physical therapy is for cancer patients is not anything new. It's just something that we are today emphasizing that it's out there and available, because most people don't realize it is as you're going through the treatment. Because once you're being diagnosed, you kind of think the world has ended. You're facing and you're just focusing on getting the cancer out of your body. But what we want to make sure people know is that there is treatment that will help you ease through this and make it a little bit easier on your body itself. So what would you like the public to know? How to access you, where to find you? Can you tell them exactly where you're located and what's happening and how to find you?
Absolutely. I work out of 2 different facilities, currently still spending a little bit of my time at Sports Plus Trenton. And you can feel free to, my office manager is based out of that Trenton office. Feel free to call at 731-855-7984, or you can call Kirkland Cancer Center and ask to speak to Felicia Ingram. Make sure you say Ingram, or Felicia the physical therapist, because we have about 3 or 4 Felicias in the building. So either way, and they will definitely hunt me down and make sure that we make contact. I have some people that typically they just call because they have questions, and I'm more than willing to talk to you over the phone, answer whatever questions you have. But the big thing that we want to do, because what we're discovering is, and I hear a lot from the cancer patients, is, they come in and they have such a defeated look. And I said, well, what's going on? And I said, I got the diagnosis. I got the chemo, I got the radiation, and then after all that was said and done, I was left with all of these side effects, and I almost feel like people are telling me, just be glad that we saved your life. Just be glad that they saved your life. But my question is, what kind of life do I have if I don't feel like going to the grocery store, if I'm hurting all the time, if I'm, those type issues. And that's where I come into play. That's where I come in, because I want to give you quality back to the life that you have been given, that you have been spared.
So it doesn't have to be during their treatment. So if they've been out 6 months after their treatment and they're still feeling bad, or even up to a year, or later or longer, they can still come and see you and get back that quality of life. As you were describing earlier, you will do the assessment to see what is holding them back and what's going on in their body, correct?
Absolutely. And you don't necessarily have to be a patient of Kirkland Cancer Center to see me.
I was about to ask you that, if you have to be a patient or if you have to be referred by a doctor to come see you.
It just depends on your insurance. There are some insurances that do not allow you to come directly to me, but there's a greater number of insurance companies that do allow people to just call and self-refer themselves to me.
Gotcha.
But my office manager and the staff that we have at Sports Plus to help with that, we help to figure out what it is that your insurance requires, and then we go the extra mile to help you get what you need.
Gotcha.
In order to come in to see me.
So you can still call direct, and if insurance needs a doctor referral, you take the extra step to call the doctor because of your credentialing. They understand there is a problem, and usually they'll go ahead and approve that, correct?
Absolutely. And one of the other things that we do at Kirkland Cancer Center, we know that cancer is expensive. The treatments are expensive, and a lot of people are left with a huge debt after the treatments are over. So we're trying to minimize the financial burdens that we're placing on the patients. And so we offer a free 15-minute consultation with me. And that's just an opportunity for you to sit down and say, so many people say, well, I don't know if I need you or not. And so then I take it from there. I start asking the questions. I start checking things out and seeing, do you need physical therapy? Do you just need some education? What is it that you need? And then we go from there.
So, at that point, they may or may not need it at that time, but through that 15 minutes, you may find out, could be at the beginning of their course or in the middle of it, or it could be 6 months out. So if they truly need to take advantage of the 15 minutes free assessment, correct?
Absolutely. I have a situation right now where there was a lady that when she took the 15-minute consultation, at that time, she and I both determined that she was doing fine right at that point. She really didn't need me, but she hadn't undergone radiation therapy yet. And so I just gave her my information and told her, if you need me in the future, no matter how far in the future it is, call me. And so months later, she calls me and she says, Felicia, I think I need you. She came in, and yes, she definitely needed me. But the thing that I also want to throw in is the fact that whenever I sit down with the patients, whether it's through an evaluation or free consultation, if I see that you do need physical therapy, thankfully, we have so many different locations across West Tennessee because people are traveling from all over the place to Kirkland Cancer Center. We had a meeting yesterday, and it was discussed that most of our patients are driving 25 miles or more to come to Kirkland Cancer Center for treatments. And so with me knowing that, I'm also knowing that people, because of their time, because of their money, they don't really want to have to drive to Jackson for their therapy. So if it's something that I know that a physical therapist in their area can treat, then I will refer out to a therapist that I feel like is qualified to meet their needs.
That is great. That's great to know. Also, if, say, in the 14 locations that Sports Plus has, if they want that free consultation, can they do it at one of our other locations?
Absolutely.
That's great to know.
Earlier you were talking about, say, a patient may have tingling in their hands, but then you do a neck assessment and determine that was the issue and that tingling goes away. Outsider perspective looking in, I wouldn't immediately think that the neck is what is making the fingers tingle. So I guess my question is, what do you say to the skeptic who is saying, well, how can the neck, obviously it's the spine, but how can the neck affect my hands?
Then I go through giving them a little anatomy lesson, and I will draw to the best of my ability. I'm not a good artist, but to the best of my ability, I will draw. But I also have a spine model that I typically want to go to just to keep them from having to go through my whole inability to draw. But I show them the anatomy, and I show them how the nerves from the neck are going into the arm area and how all of that is connected.
Is that a common question? Do people ask that?
They do.
So as you can see, our physical therapists are trained extensive to understand the body.
Yeah.
And just saying that's a great question, because most people think that tingling is going to stay there, or the numbness in the foot, and it does. Everything is connected. in your body. So you've got to figure out where it's coming from. It's not just your hands. Like you were wondering, how's that connected to your neck?
Right.
So that is what her goal is when she sits down with a patient, and all of our physical therapists, when they sit down with a patient to find out where's the true underlying problem. It's not just your little fingers, or it wasn't side effects of the radiation, truly radiation on some of them. So that's the reason we have her in the place where she's at, because she can help find that underlying problem. And that's what we want to encourage people that are listening now, to know that you're not out there suffering, that you can come see us and let us get you back to a normal life, or as close as we can get you to.
And the big thing we want to do is, in this modern time, a lot of times people want a quick fix, and they'd rather take a pill. But you have to be careful with that, because with every medication that you take, there's a side effect. And the more you take, the more chances you have of those medications interacting. So why not go the natural way? Why not try to figure out, is there something that I can do? Is there a movement that I can do that can fix this problem? And the other good thing about that is, instead of you saying, well, the problem's back, now I have to make another doctor's appointment, got to pay this copay in order to get this prescription. Instead of doing that, we will make sure that we equip you with the knowledge of being able to do a self-assessment, to be able to say, okay, now that I've gotten the physical therapy, I have the tools that I need to be able to assess myself to see if this problem is trying to rear its ugly head again. Okay, yes, it is. So now what do I need to do? And we make sure that you know exactly what you need to do. That's not to say that 100% of the time that's going to work. There are some patients that have to come back to us because it's worse than they can handle on their own. But the good thing is, in those instances, you don't end up having to come to see us for 2-3 months. The approach that we use, we laugh about it and say it's so good it's going to work us out of our own jobs because we get results pretty fast. And that's the thing that Leanne Childress, our director, always emphasizes on us, because so many times one of the negative stigmas that people tend to attach to physical therapy is, oh, they're just trying to gouge you for your money. That's not what we're trying to do here. Sports Plus, our goal is to get you better faster. And that's in whatever setting we're in.
That's a very good point. A lot of people do feel like physical therapy is going to be 6 weeks or longer to get them back to their normal life. But what they don't realize is the way we do evaluate people, and our goal is to get you better faster. And the MDT techniques that we have been using is proven. We've got great outcomes and have the documentation to show that. So don't let that be a fear. If you're listening to us today, don't let that be a fear that, oh, I'm going to be in this forever. No, our goal is to get you better and get you back to life as fast as we can.
Yeah, that's great to know. So, Felicia, will you mind plugging the phone number again that people can reach you at?
Sure. It's 731-855-7984.
If you happen to be out there on Facebook looking, we have a Sports Plus Trenton page. Go ahead and like that page and follow Felicia's information out there, and you can contact her through that as well.
Well, this has been a great episode of We Talk Health. Thank you guys so much for coming in today. Felicia, keep doing the Lord's work. You're doing a great job. I know the patients around West Tennessee really appreciate it, and so do we. Thank you guys again so much for being here today, and this has been another episode of We Talk Health.
We have 14 convenient locations to serve you, so if you're experiencing any type of pain, or if you just have a simple question you'd like to give us a call, you can call us at 800-427-0957. We have 5 in Madison County. That would be our Sports Plus North, South, our Sports Plus Aqua Therapies, Lift Therapy, and Work Plus Rehab. Yes, Lift Therapy is part of our Sports Plus, so keep that in mind as well. If you also are living outside of the Jackson area, we have Sports Plus Alamo, Brownsville, Dyersburg, Henderson, Humboldt, Lexington, Medina, Milan, and Trenton. So if you are living in West Tennessee, we have 14 convenient locations for you.